What's up, everybody? It's Dr. Scott with the 2-Minute Fix. So what I want to cover today is ankle mobility. And this becomes very problematic in a lot of people when they're first starting out, especially in CrossFit or weightlifting, trying to get into that full depth squat, and the ankle range of motion is limiting their ability to do that, specifically a short heel cord. So I'm going to cover a couple of different ways to address this today. Okay, so what we're talking about is primarily the inability to what's called dorsiflex the ankle. That's flexion or dorsiflexion. A lot of times when people are first starting out, they can't get into a full depth squat because this heel cord is too short. A lot of times we do sort of the classic runner stretch, trying to just pull that ankle back. What I want to show you is just a little bit of a variation on that. Basically, what I want to do is actively engage what's called the anterior tibialis, the shin muscle, in order to elongate and neurologically inhibit or get that basically calf, gastroc, and Achilles to relax. Again, I prefer not to do these 30-second long holds. Really, a little bit of help with the band and just holding for a couple of seconds, actively engaging, again, that shin muscle. The gastroc is stretched with a straight leg, but the soleus is actually stretched with a bent leg. So if you're going to do a classic runner stretch, you want to do both straight leg. So if we're stretching this one, I'm going to do both straight leg and bent leg, trying to push that heel to the floor, and that will get both muscles. But how I really like to do this is with a band. Make sure you have a pole, something firm to attach it to. You're going to slip the band over the front of the ankle and mobilize the tarsals. A lot of times this restriction is because there's ligamentous adhesions and soft tissue adhesions built up in those tarsal bones, the little bones in the ankle. Okay, so what you want to do is grab the band, step through, and put that band right at the crease of the ankle. And that's going to help us mobilize that tarsal. So stepping out almost as far as you can without losing your footing. Get into that kind of classic calf stretch, keeping the heel on the floor. And these ones you do want to hold for about 10 or 15 seconds to try to release any adhesions that have developed in there. You can do the same thing with the bent knee as well. So use that technique to mobilize the ankle joint. Obviously in my office, in my practice with my patients hands-on, I would use ART, some ankle mobilization and adjustments to speed that process up. It's been Dr. Scott with the 2-Minute Fix, #DoesYourDoctorEvenLift. Stay tuned for the next one.